Hey everyone, my name is Lisa Stokes, and I just want to thank you all for joining us today. Believe it or not, we are halfway through our virtual series. This is week 4. I'm very excited that you can join us today, and I'm very excited to introduce our guest speaker. Just to let you know, our goal with this series is to support you as coaches and athletes during this pandemic by providing education and resources to help you stay active, take care of your body and mind, prepare for upcoming seasons, and prevent injuries as we begin to do more. So today I do have the privilege of introducing Brandy Gerdes, and she is going to target the topic of this week, which is sleep. A little background on Brandy: she is a registered sleep technologist and has been with WellSpan for the last 6 years. She works between Dover and Gettysburg offices, and overall their sleep centers. Prior to joining the WellSpan team, she worked for a company that performed sleep studies on the Baltimore Raven players. This and conferences that provided educational talks regarding the connection between sleep and athletic performance is what got her interested in the sports medicine side of her career. Brandy is originally from Maryland and completed all of her education and training in her home state. And of course, her favorite sports team is the Baltimore Ravens. So before she gets started on her lecture, just to address a few housekeeping items, we will have a question and answer at the end, and you can participate by submitting questions throughout the presentation or waiting until the presenter has finished. If you have not done so already, please mute your computer at this time. And for security purposes, the host has the capability to unmute the participants as needed. So now I'll let Brandy, if you want to take over.
I'm sorry, can you guys hear me?
Yes.
Okay, good deal. So I'm just going to share my screen. Okay, can everybody see my screen?
Yes.
Thank you, Lisa. Well, thank you guys for inviting me to share information on sleep and how it relates to athletic performance. And so today's training is kind of geared more towards the coaches, but there are, I don't know if there are any athletes on the line, but there are healthy sleep tips and some of the same information that was shared yesterday. So today, the objectives that we're going to cover is why is sleep necessary, consequences of insufficient sleep, how much sleep do we need, the relationship between sleep and athletic performance, how coaches can help, good sleep habits, and some of the services that we offer here at WellSpan. So lack of sleep can lead to increased fatigue, a decrease in focusness. Also, you tend to be less alert. There is a higher chance for error and accidents, as well as injuries and absences as well. Consequences of insufficient sleep can be misdiagnosis of ADHD, headaches, depression and anxiety, increased risk of auto accidents, increased risk of sport injuries, heart disease, hypertension, diabetes, stroke, increased risk of dementia, obesity, and glaucoma. So as you can see, sleep is very important and it ties to a lot of other health risks. So first we'll discuss like how much sleep is required each night. So when we start out life as newborns, we get between 16 to 18 hours of sleep per day. And then as we get older, that time kind of goes down. So by age 10, we're getting about 10 hours of sleep. People between the ages of 10 and 17 should be getting 8 to 9 hours of sleep, and then adults should be getting 7 to 8 hours of sleep. So what's the relationship between sleep and athletic performance? So with athletic performance, sleep positively affects many areas of athletic performance, including speed, accuracy, and reaction time. Also, travel sports, where you're traveling for games or competitions, can sometimes interfere with the performance just due to altering the sleep schedule. So maybe you got up earlier than normal to get to an event early, or if you traveled to that event and it was in a different time zone, you could be jet lagged, and that could lead to poor athletic performance. In adolescence, fatigue and from lack of sleep is the leading cause of sports injuries. So children who get fewer than 8 hours of sleep at night are 1.7 times more likely to get injured. Also, chronic fatigue can make people at higher risk for infection and illness. And then another link between the two is the physical characteristics between certain sports. So certain athletes are predisposed to sleep apnea just based on characteristics. Athletes that do have sleep apnea that are left untreated, it can lead to not only poor performance, but it can also be hard on the cardiovascular system as well. So this was an interesting case study done at the Stanford University with the men's basketball team. So what they did was for 2 to 4 weeks, they kept their regular sleep schedule, which was considered their baseline, followed by 5 to 7 week extension where they allowed the players to sleep or had them sleep for 10 hours in bed, or had them in bed each night for 10 hours. After that, during that time of the 2 to 4 week period and the 5 to 7 week period, they measured athletic performance. So they looked at, how fast they were with their sprints, their free throws. And then by the end of that study, they realized that during the time where they had the sleep extension of the 10 hours in bed, that their accuracy improved and that their speed improved as well. So 3 main factors when evaluating an athlete's sleep. I'm going to look at the amount of time that they're sleeping. So adolescents should be getting 8 to 9 hours of sleep per night. And then recognizing the quality part of sleep too. So practicing good sleep hygiene. So we'll go over that in a little bit, what sleep hygiene is and some tips for to get good sleep. So the last area would be maintaining a sleep schedule. So making sure that you're keeping the same schedule each night. And I know that varies for a lot of people. They may adjust their sleep schedule on the weekends, to stay up later, sleep in later. But it really is important to try to keep your sleep schedule the same. And of course, don't skip breakfast. So how can coaches help? Well, for instance, what we're doing today, just educating your athletes on the importance of sleep is a big one. Also educating them on caffeine use. So, caffeine can stay in your system for up to 12 hours. So if an athlete intakes caffeine in the afternoon, it could still be circulating in their body at midnight, which could also cause, some sleep issues. When you're traveling, doing travel sports, consider, if it's further distance, not in the same time zone, consider getting there, a couple days ahead of time to allow the body to adjust to the different sleep times. If you're just traveling, locally and it's still, quite a distance away, consider getting there a night before and not getting up, cutting your sleep short the night of the event or the night before the event. Also, coaches and players sometimes before big events, they have their minds are racing with all the things that, need to get done for the next day, or just anxious about the event itself. So some techniques that can help with that is, reading before bed, taking, a warm shower, stretching before sleep. If you're a coach, maybe you want to go over your agenda. Athletes and coaches may want to make a list of things that they need for that event, so they're not sitting, worrying about, did I remember to pack, a certain item. So just getting up and doing that checklist sometimes can help ease the mind too. So some healthy sleep tips is, like we discussed, having a regular sleep and wake time. creating a bedtime routine that is something that your mind recognizes with being associated with going to sleep. So for me, I have issues with sleeping, and so I have an app on my phone that plays the sound of a box fan. So my brain is like kind of trained now that when that comes on, it's okay, it's time to sleep. So for me, that helps. So, you know, for somebody else, it could be, you know, laying in the bed, reading. Also avoid stimulants such as nicotine. Don't eat, drink, or exercise within a few hours of your bedtime. Provide a good sleep environment, you know, a dark, cool area. Limit the numbers of naps, and if you can, reduce caffeine, and try to keep caffeine out of your system 6 hours before going to bed. Obtain regular exercise. And then the last one is a really big one. Limit the TV, computer, phone, and tablet in the evening. And I know that that's a hard one. You know, so many times we're putting our phones in our nightstands, and that can be distracting, you know, with the text messages coming through, with it being so readily available for younger athletes, maybe the social media aspect of it. So it's important to kind of tuck that cell phone or tablet away at night. So at WellSpan Sleep Services, we provide a lot of different studies. So the first one would be like an in-lab overnight sleep study. And then we also offer home sleep testing, which actually ships directly to the patient's home. We also offer pediatric studies. We do it in York, but depending on the age of the patient, it's more, they may be going to Lancaster. We also provide multiple sleep latency testing, which is really to test for, you know, narcolepsy and daytime sleepiness. And then, of course, we do community education programs like we're doing today. And we also have consultations with board-certified sleep physicians to address any sleep issues you may have or any concerns. So with that, I will ask, is there any questions?
We do have one here. The question is, I know some of my athletes take naps in between tournament games. Is this okay?
Well, that's a tough one. I would say that naps aren't a bad thing, but if it's going to interfere with how they're sleeping at night, so if, you know, if they take that, you know, hour nap, is it going to prevent them from still getting their full night's rest? Would be the question.
Okay. How about the direct correlation with their performance at that tournament?
You know, a power nap might not be never. I don't ever think a power nap is a bad idea, just as long as it's not interfering with the night sleep. So when that person, when it's time for them to go to bed at night, are they having trouble falling asleep? Are they staying awake, you know, throughout the night? Are they waking up early and not able to go back to sleep? Would be where it may cause, you know, some issues there.
Okay. Another question just to go, kind of goes along with that, not necessarily the sleep between the tournament games, but how about with late night practices or early morning practices? Is that kind of the same thing, as long as they're getting their typical night sleep, that they should be able to still perform well with that?
So I would say that they still need to have time to sleep. You know, if you're having a late night practice and then, you know, that their late night practice, and then the next morning they're getting up early, you know, probably if they're not able to get their full night's rest and try to stay on their normal sleep schedule, that's, you know, that's kind of where you want to be, is be able to try to stay on the normal sleep schedule, which I know is hard with sports. But anytime you're staying up late and then cutting your sleep short to get up early in the morning, you're not going to be able to probably obtain the amount of sleep that you should be getting.
Sure, that makes sense. All right, the next question is, if I like to sleep more on the weekends, is that a sign I need to sleep more on the weekdays?
Oh, wow. Well, I think we're all guilty of that. I mean, I work in sleep medicine, and I try to keep and maintain the same sleep schedule, but I even find myself on the weekends, it's, all bets are off when it comes to that. So again, I don't really think it's, they just say to try to keep it, the schedule the same, but realistically on the weekends, people sleep longer.
Sure. All right, well, that is all I see for the questions right now. So Brandy, thank you so much for your time, dedication, expertise. Definitely some things that I think each of us can kind of take away for ourselves, for our athletes, and hopefully for the coaches as well. So thank you for that. We greatly appreciate it.
Well, thank you. I appreciate you guys having me talk. And if you have any questions, certainly, because I'm going to stop, I'm going to hang up. But if anything comes up, you can just email me and I'll do my best to answer any other questions.
Okay, sounds good. Thanks a lot.
Thank you.
And for all the coaches that are still on here with us today, thank you so much for joining us for that lecture. Hope that was informative and helpful for you. Hopefully you can provide some things for your athletes that you didn't have in your knowledge box before. So now if you can stay tuned, I think we have our workout for the day.
Hey, Lisa, there's no workout today. It's just the coaches. So
awesome.
We are
Thank you.
good. But we'll see everybody again on Friday at 4 for a workout. Or I mean Wednesday at 4 for a workout, and then again on Friday.
Perfect. Thank you.